Welcome everyone, Dr. Mandell here. Me and my good old friend, Dr. Salmon, my dentist, one of a kind, experience, been around for, God, several decades.
What I'd also like to say is that dental health is not just about dental. It's about health of the whole body, really. There's a direct connection between dentistry and several diseases, including cardiac diseases, hypertension, premature births. So it's not just dental, it's a general health issue. Healthy gums, healthy teeth translates to a good general health.
Doc, here's a question from Susan. What is the best toothpaste? Now, I'm sure patients have asked you that for years. I would be really curious because I like to know that answer. And I'm sure there probably is not one, but what should they be looking for within a toothpaste?
What you look for in a toothpaste depends on the age. If it's a child, you want a fluoride toothpaste. If it's an adult, you probably need to stick with a fluoride toothpaste, but you can also use a whitening toothpaste, a tartar control toothpaste. Even though there are restrictions to this toothpaste, for example, many people can develop sensitivities if they're using a whitening toothpaste or a tartar control toothpaste for too long. So, but the main thing about a toothpaste is that pretty much you can use any toothpaste that you want to use. You can even make your own toothpaste. The main thing about using a toothpaste is to brush as long as you can, say for 5 minutes, because the longer you brush is the more effective it's going to be in working and to clean the teeth.
I got a great question for you. Your typical toothbrush. People keep toothbrushes sometimes for a year. We look at bacteria, things that go on with toothbrushes. Maybe the bristles start to wear. Toothbrushes do brew bacteria, correct?
Yes, they do. They do brew bacteria. However, if you wash your toothpaste with effective solutions, for example, alcohol solutions, Listerine, for example, baking soda, or even hypochlorite diluted bleach, you should be able to control the bacterial count and other microorganism count on a toothbrush. The critical thing about toothbrush is that over a period of time, they become ineffective because the bristles, rather than being straight, they're now tilting at an angle. So you're trying to approach the teeth with bristles that are tilted at an angle away from the teeth. So it becomes ineffective in terms of doing what a toothbrush should do. So your toothbrush should be changed on a fairly regular basis. Maybe every month, every 2 months would be a good idea.
JC says, how often should I go to the dentist for a cleaning?
The guidelines right now, if you have no active gum issues, if you're not undergoing gum care, periodontal care, or gum disease care, you should be going, say, every 6 months. If you are undergoing gum care, the average guideline is every 3 months. It can be a little sooner, maybe 2 months in some people, or 4 months in other people. So if you have active gum disease, then you need to be seen more often than someone who has fairly healthy gums.
Hi, doctors. Can you use mouthwash instead of brushing?
Oh, no. No. There's no easy way to do this thing. It's not a walk in the park. You can't just brush. You can't just go and rinse and go, hey, you're going to go about your business. No. You really should be flossing first, and that's a lot of work right there. Okay? Secondly, you should be brushing for 5 minutes. And then you rinse with a mouthwash of your choice. And the good thing about mouthwash, you want to alternate your mouthwash. You don't want to stick with one mouthwash all the time.
That's very important, like anything else.
Because the microorganism will get resistant. The mouthwash can actually become somewhat ineffective against these microorganisms because they're very smart organisms. And you just want to change the solution so that you keep surprising the bug, so to speak. Sensitive teeth could be due to underlying issues with deep cavities, for example. Very fairly abrasive toothpaste, for example, tartar control toothpaste is more abrasive than a non-tartar control toothpaste, so you're moving more of the surface of the teeth. Could also be due to whitening in the teeth, in the toothpaste. So once you begin to use this toothpaste, you can get sensitivities. So if you have sensitivities, the first thing I'd say is watch what toothpaste you're using. Non-whitening toothpaste is better than it's not as good as regular toothpaste. It can actually increase sensitivity.
People believe sometimes they should scrape their tongue. They get that little white, a lot of the white stuff that comes
Absolutely.
up.
Absolutely, that's important. There's a layer of microfilm, a layer of bacteria on your tongue, top of your tongue, on the roof of your mouth. So you really should be brushing the roof of your mouth very gently, and also brushing the top of your tongue. And if you want to brush the inside of your cheek, that's fine too. But that's where a mouthwash will come in terms of reducing the level of bacteria on those surfaces.
Here's something. Lemon juice strips the enamel off the teeth and their sensitivity. Again, acid, you got to be careful with, correct?
Yes, absolutely. Absolutely. If you're going to be drinking, say, sodas all day, or eating lemons all day, or citrus all day, that can definitely increase sensitivity, especially when these fruits are in season, because they're acidic in nature.
Yeah. So obviously that's when we tell people, if you're drinking lemon water, dilute it. It's the dilution that you need, correct?
Yes, exactly. You want to dilute it.
Getting back into the teeth here, great question. What are your thoughts about silver fillings and root canals?
Silver fillings, I don't have a problem with silver fillings. There are controversies about silver fillings relating to mercury content and silver content. There are controversies which have been disproven. I think silver fillings are very safe. I have many silver fillings in my mouth that could have been removed if I wanted to have them removed. There's probably more silver in the food we eat than being released from the fillings we place in people's teeth. So I think silver fillings are very safe. The literature shows that they're very safe. Our profession don't recommend removing silver fillings, and they don't go against placement of silver fillings.
I want to share his education because he's very, very brilliant. And again, as much as I talk about physical health, dental health, oral health, is the man right here. He's the one. He is the expert. He's the professional. And this is what he's doing. And I love learning from him all the time. Yeah. Can enamel be rebuilt?
Can enamel be rebuilt?
Yes, that's her question.
Enamel in its natural state as found in your mouth cannot really be rebuilt. But there's good substitution for enamel, which would be composite fillings, tooth-colored fillings. And when that's done, it's done almost perfectly. I mean, you've had cosmetics work. It's done looking so beautifully. So you really can't tell the difference just by looking between enamel and a filling material.
What is plaque, Doc?
I think most people refer to plaque as a material that they can see.
But you normally don't see plaque in the early stage.
You can't really see plaque. Now, if we talk about plaque, it's an invisible material which takes about 24 hours to form. It's removed very easily by brushing and flossing, which is why you must brush and floss every day so that plaque does not get transformed into what's called tartar, which is very hard. And I think this is what the question is referring to. It's very hard, difficult to remove, because you have to approach your teeth at a certain angle to remove it. And oftentimes you're removing the plaque that you can see with your eyes, but there's also plaque in the gum, deep in the gum, which you cannot see. And that's the plaque that's going to cause bone loss, or tartar that's going to cause bone loss.
Here's a man that goes in other countries from his heart, takes his crew with him, and with his own expense goes out and helps these children. And that's a blessing. And I want people to know that, because I do the same thing for children, not for mouth, not for teeth, but in other ways. So that's why we get along so well. By the way, Dr. Salmon is located in South Florida. We're in South Florida, United States, in Miami Gardens. Some people are asking where you're located because you know what? If these people out here maybe don't live here, but maybe they have relatives, maybe they have a family or children who live in the area in South Florida. We got a little fly on you. I see a little fly on your face there. I think you must be smelling sweet there or something. But they like that's okay. But by the way, I will leave his link below so people will have the link of your website. They can always get a hold of you if they have any questions. Sarah here says that crowns or veneers for front teeth. Now, obviously, he does so much of those beautiful things. He's done wonderful things for my teeth. When it comes to crowns and veneers, this is definitely up your alley. What comment or quick comment can you make about that? Crowns versus veneers, or I have no. You tell us.
Yeah, they're clear indications for crowns and veneers. Veneers are not as strong as crown. Veneers are more cosmetic. Crowns are usually used. Crowns are used to protect the teeth in 3-dimensional, the front, back, side of the teeth, all over. Veneers are more on the front of the teeth and used mainly for cosmetic issues. They're less invasive. There's less destruction to the teeth. is done in order to accomplish a cosmetic result.
Dr. Harshaw says vitamins and bleeding gums. Bleeding gums. Now, I do know one thing I can say towards that. We know that vitamin C plays a critical role when it comes to bleeding gums.
Definitely, yes. Does play a critical role. However, in modern society, vitamin C deficiency may not be a big factor in the diet anymore. I don't know what is your feeling on this, but it may not be a big factor in our diet anymore. So bleeding gums become more related to inflammation or infection around the gum due to gingivitis, due to periodontitis, due to gum disease.
We appreciate your love very much. And subscribe, hit the bell. I have some great information, great experts coming on with you, and you will be back, Doc. You will be back.
Thank you. It was fun.
I knew you would enjoy this. See,
it was fun.
You just get on and just feel the love, man. It's all about the love.
Yes,
and let me tell you something, Doc. You did an amazing, amazing job. You really did. And thank you for being
here. Thank you.
Because I really don't want to let anyone down.
Thank you so much for the invite. It was fun. It was a lot of fun.
Yeah, I knew you would love it. God bless everyone. Stay well, stay safe, and we'll catch you next time.